I'm Dr. Kenneth Levine with Health Talk. We're back here with Dr. Andy Wasserman. Andy, we left off talking a little bit about finances and things that, as I said, we finance our care up to 7 years if necessary. Do you have any issues now with, it's been in the news about automobile accidents and care for for those patients?
Yeah, recently, as of January 1st, 2013, there are a few new laws. You have to absolutely get treated by some kind of medical professional if you had an automobile injury after January 1st to document that you had an injury within the first 14 days. Otherwise, you will have no medical coverage under your automobile policy. It's also limited to $2,500 unless you can certify that it's an emergency medical care documented by an MD, a DO, or a dentist. And it has to be emergency medical care, which is really ill-defined. But if you can do that and the doctor agrees it's emergency medical care, you can have the full benefits of your policy, which is usually $10,000. So
Gotcha.
It behooves you to get in early, treat it right away, and make sure you follow the advice of the medical professional.
You know, in our profession, many times the chronic problem is more difficult to treat than the acute problem. Do you have the same situation?
Sure we do, because the chronic problem has been hanging around for years and years. It's formed scar tissue, bone loss, degeneration of the disc, maybe nerve impingement, and there is no going back. We don't have any replacement parts of the spine.
Right.
So we have to make the spine more functional through exercise, through therapy, and we can't replace the parts, so the old problems are really, really hard to take care of. Sometimes. We have pretty good results, but sometimes, again, we have to send them out.
Well, you know, I've been told that the parts don't get better as we get more mature. Before I forget, would you please let people know who are watching where they can find you, your address, phone number, website, and things like that?
Sure. We're on Sample Road at 10394 West Sample Road, just slightly east, 1 block east of Pine Island Drive or Coral Springs Drive. We can be reached at 954-755-1980, and our website is wassermanchiropractic.com, and all the information you want about our practice is on there: patient forms, different services, insurances, sitting down syndrome, which is a little video we have for people who work at computers, tons of information. And if you want to access that or even contact us to make an appointment, you can do it through the website.
Can people refer themselves?
Yeah, actually the HMOs for almost any other specialty need referrals, but for chiropractic, they do not need a referral. They just call our office, whether it's Humana, Coventry, United Healthcare, Blue Cross Blue Shield, whatever. They can just call our office and get in, and very, very rarely do we need a referral.
If somebody wanted to come in and meet you, talk with you, look around your office, get an idea of what their opportunities are, is there a fee for that?
No, there's no fee to come in, have a tour of the office, have a short consultation to see if actually I can help you, if I think I can help you. If I can't help you, I'll tell you where to go, and if I can, I'll tell you what we should do next, and we'll be upfront with what it costs and what's involved.
You know, several years ago, we made a decision for our practice that we do not charge for our exams, consults, radiographs, and people get to meet me. Actually, it's an hour of my time at no fee, because we feel that everybody should have the opportunity to at least learn what opportunities, what benefits are available to them for their dental health, and what the consequences are if they don't have care. So I was convinced, and I resisted a little bit, to take away those fees for that, but it's really worked out well, because once they meet us, they usually tend to stay. They like us.
That's true.
Right?
That's true.
In your professional life, has your specialty as a chiropractor, has that changed? You've been doing it for a while.
Right.
Have things changed a lot?
Tremendously, actually. The new techniques they've come out with, especially in soft tissue care, physical therapy, and rehabilitation, didn't exist when I first started practice. So I've had to learn along the way, and every year we update our qualifications and our skills. Fortunately, some young guys come into the practice that bring along their special skills, and I've had the opportunity to learn from some of the best in the business way back when I started. So I had some of the old school and some of the new school, and it's really worked out well to blend all these different philosophies and techniques together.
Well, you know, I've been told that you need somebody who doesn't have a little bit of gray hair is good, and the more gray hair is getting better. You don't want anybody who doesn't have any gray hair at all, because they have no experience at all. They may have all the current knowledge, but we learn continually. I'm like a continuing education junkie. I go all over the world learning things and teaching things, and I work with younger colleagues who, as you said, bring in new things. Well, you know what, Andy, this has been very special. I appreciate your time and look forward to come visiting your beautiful office. Thanks for coming in.
Hey, thank you very much for having me.
It's a pleasure.
Appreciate it.
See you soon. It's Dr. Kenny Levine with Health Talk. We'll see you next week. Thank you.